This internship program is a 4-week program where the students joined us and they shadowed over 25 different departments throughout the hospital system. They had opportunities to go and spend time in our Springfield location in our simulation lab, so they got to be in the ambulance, they got to help a patient up, and then they also spent time with our other partners in SIU, and also they had lunch and learning opportunities, so they met with our women providers, they met with our leadership team, so they really had an all-encompassing opportunity this summer to see what it takes to run our hospital. The growth was really awesome to watch as they came in, and they were all in different places. One young woman, Jada, she came in and was very shy, very quiet. She was our youngest participant. By the end, she took charge, she was leading things, she was having conversations, and really we saw some evolution with her.
Could be something that I could really do. I could see myself doing, helping somebody else, family members, or helping one of my family members take care of themselves and get them back out to where they need to be. I think the next step is for me to do the health professions program, and to later on in the summer, to next summer, to hopefully get my CNA by the end of that summer, and to keep going into with DCLI because they're a really good program to help me build my career path for every next step that I go in my future.
Ariana was super smart, our graduate a year earlier, seeing her come out of her shell and seeing her mind work, and I'm excited for her career path as she wants to be a pathologist.
I've definitely gained social and a lot of connecting with people. It helped a lot for my future. My interest in healthcare started when I was a kid. I did know that I wanted to be in healthcare, but I didn't know what type of field or anything. My favorite thing that I shadowed here is definitely the cath lab and the OR. They're both dealing with surgical things, and I like all the hands-on stuff and visualizing the things. My next step is to go to college to get my associates, and then I'll be going to the Air Force after that and continuing my education in healthcare.
I've come a long way, and honestly, being here right now, I'm surprised at myself. Like, I'm talking a lot more. I couldn't thank DCLI more for this opportunity because, I mean, it's given me a lot of, I would say, personal development. It's given me a lot of character, actually. So my focus did actually change a little bit based on, because of this whole experience. I was thinking about becoming a midwife or like a mother-baby nurse. Just recently, I started thinking about administration. I did not think of that at all when I first came through this internship, so here we are. Just talking with the colleagues, I would say is like the most enjoyable thing that I've done throughout this entire experience.
Ray already works for us, and so seeing her develop her leadership skills and help guide young women, where she came in as almost their peer, but as she learned how to step into the leadership, how to guide and help them along the way. And then Amia, seeing her grow and light up rooms and bring that brightness when she enters the room to share with our staff was really fun.
I went into the DMH intern program because it was presented to me, and why not do it? Like, why not go into a program where you can learn about healthcare? What was really fascinating to me about this internship was the way they came together for us. They really advocated for young girls, and it's not like an opportunity that you can get. Like, it's not something you can just pick up out of nowhere. You got to be a select few. It was actually something that I really enjoyed and I would love to keep doing. Just the chance to get to experience all around the hospital was one of my favorite moments. My favorite place in here was OB. I loved it there. It felt like home the moment you got there. It doesn't matter, labor, ultrasounds, I don't care what it is. Like, dealing with kids is one of my biggest things I really love. Like, bringing life into the world is like something that I think it's just magical. I plan to apply here. I know I'm not old enough to be in certain parts of the hospital, but I'm going to find my way here. I'm going to come here and I'm going to thrive, even if it's not in clinical. If it's non-clinical, at least I'm still here. That's what I really enjoy.
The DCLI program is important for us because it creates pathways for students, and also through other pathways through the programming that they do is for people to have exposure to careers that help elevate themselves, their family, and change the trajectory of their families. And really for us, it creates another source of pipeline who have people who are career ready. So, and because they take the whole entire look at the person, so then you have financial literacy, you have exposure to things that you may not have. And so they really come to us more work ready and making them a good pipeline for us for our talent. The really awesome part, I think, for my role is being able to connect them to tangible people who are within their age range and helping them build bridges that hopefully will last a long time.